So maybe I'm. Sorry about that. So I just suddenly got asked to authenticate myself on Teams. I'm going to start now. Sorry about that, everyone. And welcome everyone to this webinar. I'm going to very briefly introduce Ben and then hand over to him. So thank you so much. It really is an honor to introduce Benjamin Perks, who is currently the head of campaigns and advocacy in the Division of Global Communications and Advocacy at UNICEF and based in New York. He and at UNICEF, he leads public and policy advocacy on the development and protection of children. And he asked me perhaps just to mention at the start that he is speaking today in his personal capacity. This is not the launch of a UNICEF campaign about a child development revolution. However much we all would like that to be the case, but maybe that'll be next time. Ben has served while with UNICEF in Georgia, Kosovo, Afghanistan, India, Albania. He was the coordinator of the Back to School campaign in northern Afghanistan, which brought 3 million children, including 1 million girls, into school, many of them for the first time in their lives. He's a senior fellow at the Jubilee Centre at the University of Birmingham in the UK, and an associate faculty member at Oxford University's Department of Social Policy and Innovation. He's recognized as a public speaker and campaigner on ending child trauma. And maybe, Ben, next year we can have you back to launch the book that he has recently completed called An Attachment Revolution, which will be published in early 2025. So yeah, it gives me great pleasure to introduce to Ben, and he's speaking. His title is "A Time for a Child Development Revolution." And please, everybody, there will be time at the end for questions, and if you want to put them in the chat or afterwards, both are acceptable. Over to you, Ben.
Thank you so much, Mark, and it's a real honor to be with all of you today. I was in Cape Town just a few weeks ago and met Mark, and we came up with the idea of having this conversation today. I want to start off with a little bit of a story. In 1980, a very debonair American public health specialist called Dr. John Rode delivered a paper at the University of Birmingham in the UK, where I happen to be a senior fellow, complete coincidence. But in the paper, he proposed the idea that while only 20% of the world's children were vaccinated against the 5 major preventable diseases, it was now possible, based on the implementation science and our understanding of public health, to reach every child on the planet with vaccine against those 5 preventable diseases and dramatically reduce child mortality. The head of UNICEF at the time, Jim Grant, heard about this paper and took it as a cause and promoted it at headquarters here in New York, and then had a conversation with our partners at the World Health Organization about whether this was an idea they could take forward together. And there was a huge debate because a lot of people within UNICEF and within WHO felt that you couldn't really focus on just 1 or 2 things like a vaccine. You had to always address the full range of issues that affect maternal child health and primary health care. John Grant believed, as did John Rode. Jim Grant believed, as did John Rode, that vaccines could be potentially a Trojan horse. They could be an accelerator to where governments and societies could agree a target, but through this it would improve the entire child and maternal health sector. They had a debate and they came up with kind of a compromise that they would focus on 3 or 4 important health interventions that they would try to make universal. And they were, can you see my next slide?
Yes, got it.
You can see that, great. So it was vaccines, it was oral rehydration salts that were designed to prevent, well, we all take them when we have an upset tummy. They were designed to, in this case, to address acute diarrheal diseases, which are a major killer of children. And then 2 other interventions related to nutrition. One was promotion of breastfeeding, and the other one was growth monitoring. So governments and public health systems would measure the growth of children through the early life course. And this all came under a very clear banner of ending preventable child death. This framing was so clear that it could give the kind of elevator pitch that it could be advocated for with a minister in an elevator pitch. The minister could get out at the other end, walk to the end of the corridor and advocate it to the rest of the cabinet. It was clear, it was infectious, it was compelling, and most importantly, it was doable with the right kind of technical support. So a bigger coalition was built with across the UN, with civil society, with foundations, with governments, and most importantly, with health practitioners and community leaders to dramatically increase provision of these interventions. So by the end of the decade, through this global effort, vaccine coverage had increased from 20% to 80%. This is possibly, with no exaggeration, humanity's greatest global accomplishment. We often commemorate, quite rightly, catastrophes that have blighted the world, the Holocaust, the transatlantic slave industry, apartheid, but we don't celebrate enough interventions like this where the world came together and saved and solved a major issue. And today and every year, millions of children survive who otherwise wouldn't. And in the decade that followed the child survival revolution, the decrease in child mortality was 61%. What's important about this is that it not only saved children's lives, it also created a world in which most of us no longer believed it was acceptable or inevitable or preventable that children would die of preventable diseases. So this was in every sense a revolution in the way we acted and the way we thought about child survival. This revolution is not completed yet. There are 20 million children today on the planet who are not vaccinated against any major disease. There is backsliding on vaccination coverage and other health coverage in the wake of COVID, of anti-vaxxers, of political polarization. So we still have a job to do on this. And our organization, and I think the global public health community, is not walking away from this at all. There's still much work to be done. This is not a finished issue. But one of the things that is emerging globally is a recognition that in many ways, science at the heart of child development and child protection, bringing together a convergence of neurobiology, of psychology, of pedagogy and implementation science, is begging the question, are we now at a stage in history when it's time for a child development revolution, when we try to ensure that every child on the planet is able to grow up safe, loved and nurtured? And if we were able to have a child development revolution, what would be the 3 or 4 doable, impactful, accelerator outcomes that we would want to see at the heart of that revolution? And that's an open discussion, but we'll come back to it a bit later on. But why could it be time for a child development revolution? This convergence of science has created, and I told Mark that I went to the bookshop in Cape Town, and there's a whole non-fiction section dedicated to child development, trauma prevention, and parenting. We are perhaps the first global generation in history to be really metacognitive and thoughtful about childhood, about parenting, and the way we and the way that we parent and were parented ourselves, and the connection between those two things, and what it means for our families, but also for society. And what we have learned through all of the recent explosion of science and conversation about childhood is that childhood is full of promise and potential, but also full of risk. We now know that children, and this is the history of the brain part 1 and about early childhood. We now know that early brain development and the higher cognitive functions, the emotional and social development of the child, begin an explosive period of growth in the last trimester of pregnancy and through the very early years. We know that in the last trimester, children babies are vulnerable to brain impact from stress that the mother may hold because of domestic violence, may experience because of domestic violence or poverty or other issues. We know that when children are born, they are not born and then form relationships. They are born into relationships, and they are biologically programmed to seek a deep, loving attachment with an adult caregiver, and that is an essential for their development, for their ability to navigate the world. But it's also, when it's absent, it is perceived immediately by the child as a threat and as a risk. For children, safety is not just the absence of violence, it's the presence of love and attachment. So we know that critically, as children go through those early months and years, that stimulation is what Harvard Center for the Developing Child called serve and return, is essential for child development. Children are asking, by some estimates, up to 100 questions an hour, and by gesturing, by body language, and later using actual language. And round about the age of 3, those questions switch from what and when to how and why, and curiosity begins to need a response beyond the family. And that's when we see the importance of preschool and learning through play. These early years, the proliferation of brain development in the early years is counter to the way we often see learning. We tend to see the importance of learning in reverse order, giving the most prominence to universities and higher education, and then secondary education, and going downwards in terms of the younger the age of the child. But what we've now learned is early investment builds the foundations of all learning, and it's essential that we value this part of child development much more than we currently do. We also know that adolescence is a time, and recent research in psychology and neuroscience coming together has helped us to understand that adolescence is very much a time of brain reorganization. Going way back to the time of Shakespeare, people just perceived adolescence as a time when young people go a bit crazy, it's a bit of a nightmare for everybody, and then they come out at the other end. What we now understand is as much as neurons grow and connect and proliferate in the early years of childhood, they are pruned and shaped through adolescence to help the child go through the critical transition required to take on adulthood. And for adolescence is a much longer than we previously thought, starting in around 11 or 12 and actually continuing till about 24. In terms of brain development, we see that the adolescents are much more likely to be drawn towards emotional spark, social engagement, creative exploration. And this is often a massive opportunity for young people to grow and develop in a healthy way and build the kind of personality and the person that they will become through adult life. But it's also a huge period of risk, because if that attachment and connection has not been there earlier on and support is not given to the child throughout their development, it's a time when that emotional spark and exploration, creative exploration, can be turned towards risk. I often think, when I think about adolescence, I think about the Beatles and creative energy and the potential, but I also think that the same things that draw young people towards positive engagement can also take them towards risk, to gangs, to other forms of risk that can have really serious impact on them, their families, and their communities. So one of the major barriers to ensuring that children grow up healthy, we now know, is adverse childhood experience. I'm sorry for the slightly dramatic nature of this slide, but it's broadly these 10 things that go on in the home. They're grouped into 3 things: violence, physical, sexual, verbal, psychological violence, neglect, including emotional and physical neglect. Emotional neglect is often very much underestimated as a real barrier to child development. And also the areas of parental dysfunction or household dysfunction, addiction, domestic violence in the house, incarcerated household member, somebody with undiagnosed mental health problem. These are perhaps the most significant barrier to child development. There are other structural issues, racism and poverty, that go on outside the house that are also have a huge impact on the child. And we have a lot of work around those issues too, but this is primarily a conversation about what happens in households and in early childhood development. So I'm going to show something, a set of data, and I want you to guess, and I need Mark's help because I can't see the chat box. I'm going to show a set of numbers, and I want you to tell me, these are child protection numbers. I want you to, in the chat box, or just shout out what you think these numbers are. So let's start off with a less than 2%. These are child protection data points.
Therefore, nothing. Just a sec. I'm waiting for. Anybody want to guess?
Okay, this is the average number of children in high-income countries who are either under a child protection order or somehow in conflict with the law. So the next figure is 13%. Anybody want to guess on that?
This is probably an audience that knows Hans Rosling's guessing of figures, and we all get it so terribly wrong they're embarrassed.
Oh, okay, all right.
I don't know.
I'll just run through them. It's probably better when I do that thing live. So I'll just, given the Hans
There's
Rosling
one
thing, I'll
person's
just go
guess
through
there
them.
for the 13%, Ben. Physical abuse?
Yeah. Yeah.
Sexual abuse, another guess?
Close. So 13% is the across 40 country studies is the number of children that experience, or the number of people that experience 4 or more adverse childhood experiences in childhood. So, but I think the others were good guesses as well, because there's a lot of crossover there. So the next one is 35%. Anybody want to guess what that is? That's quite a tough one. And it's a very rough estimate.
I've got a guess of 3 or more ACEs.
No, 35% is approximately the percentage of people that have some form of insecure attachment style in earlier psychological research. The 57%.
Yes.
Any guesses?
Nope.
Okay, 57%, again, going back to the 40 country studies of adverse childhood experiences, I think it's 37 studies. One where this is the proportion of the population that have one or more adverse childhood experiences. Sorry, have one or more adverse childhood experiences.
Yeah.
And the 80%?
Maybe that there's one guess of violent discipline, but maybe that's the 3 or more. The person said 3 or more, maybe. I don't know.
No, 80% is absolutely right. It's violent discipline, according to the UNICEF last piece of population level data on that. And that will be updated in the coming weeks. Happy to share that we will be launching that soon. Great. Okay. So, but the importance of this slide is, with the research on adverse childhood experiences, it's completely changed the way that we look at child protection in the world. So we used to think about child protection in terms of that 2%. So it used to look something like this, right? You look at a classroom, statistically, you'd think that there would be one child who would be on a child protection order or in conflict with the law. But if we give the children a adverse child experience score, according to, sorry, just to say, this is the data from the kind of a systematic review of countries, and you can see that they're across continents. What it told us is the classroom actually looks like this, that the prevalence of different adverse child experiences, what we could describe as risk factors for trauma, are spread across a classroom like this. So case management with children who are on child protection orders or in conflict with the law remains massively important work. But what we also need to think about is primary prevention, because this is a silent emergency, it's a silent endemic. And when we look at that classroom, what we see is the 4 children at the back with 4 or more adverse childhood experiences tend to be at much greater risk of worse outcomes, not only in early childhood in terms of early childhood development, but also throughout the life cycle, because we can see that we can see a dose response correlation between the number of adverse childhood experiences one has had and the worse life outcomes across 40 well-being indicators. This is actually data from the US, but this is now so robust because it's integrated in routine surveillance across most states of the US. So it's a really strong population view. Also important to say that the prevalence of adverse childhood experiences and this negative outcome correlated is common across all different types of countries. Most countries surveyed have between 10 and 20% of the population having 4 or more adverse childhood experiences, and somewhere between 50 and 70 having one adverse childhood experience. We tend to think about these outcomes in terms of learning and health, but it's also important to go back to that risk piece that I mentioned earlier on in terms of adolescence, where this is data from Wales now, and it's looking at, shows it's probably one of the most convincing pieces of data that explains the intergenerational nature of violence, because it shows that adults who've had 4 or more ACEs are 14 times more likely to have been a victim of violence and 15 times more likely to be to have been a perpetrator of violence, much more likely to be addicted, much more likely to have had risky behavior in terms of teenage pregnancy and so on. We know that here in the United States that 90% of long-term offenders who repeat offenders who began their criminal career in youth detention facilities have had 4 or more adverse childhood experiences. Almost 80% of recruits to radical racist groups in the United States, 4 or more adverse childhood experiences. Most of the children who were trafficked in the Epstein scandal were children with young people who had high ACEs. This is something that is becoming increasingly clear, that a major risk factor for all of these things is adverse childhood experiences. Yet, when people organize conferences on crime prevention or radicalization, they very rarely have an expert on child trauma attending, and this primary prevention language has not yet entered into the security sector and the justice sector in the way that it should have done. But if you put all of this together, if you put these outcomes, the poor health outcomes, mental health outcomes, and so on, we see vast costs to society. And if the group, Mark Bellis and others who are probably on the call, so some people who are perhaps on the call were involved in a costing of to United States, North America, and Europe of the adult outcomes in terms of health alone from adverse childhood experiences, and they're estimated to be 1.3 trillion. A global economic study of the impacts of violence against children suggested that 8% of GDP was spent on the adult outcomes of violence and maltreatment of children. We have data coming from on GDP costs and others being developed in countries, and we're getting a much greater understanding of the huge economic cost of this. So even if people don't care about children's rights or child development, the most hard-nosed economists can agree that it makes absolute sense to invest in primary prevention and ensuring that every child grows up feeling safe and loved. There is also the famous Pegman curve, which I know a lot of people have got concerns about, but it's good as a navigational indicator, suggesting that you have the biggest return on investment of the public purse if you invest early. I think Professor Tomlinson and others would say it's really important to continue that investment throughout childhood, otherwise the gain is lost. But this is, I think, a lot of this work on the economic impact of not ensuring children have the best start in life, and also the return on investment and cost of inaction is really at the very beginning. It's something that is developing, but I think it points us in a direction of the urgency from an economic as well as a child development and human rights point of view to act. So if we had a child development revolution and we wanted to ensure that every child safe, loved and nurtured, what would be the 3 things that we would want to include in that? Remembering that these have to be the things that are the greatest accelerators for the biggest range of outcomes in a sector. They have to be doable, understandable, contagious for policymakers. What would you suggest? And again, I open this to the floor and I ask Mark to relay the answers.
First one is cuddling.
Cuddling.
Second one, parenting programs.
Good. Okay. I like cuddling, but it has to be a government policy.
Okay, I've got responsive caregiving, stronger support in pregnancy, early child development support for fathers, parental education on attachment and trauma.
Yeah.
Government, okay, anybody got ideas of government policies, programs, opportunities for early learning? Oh, this is lovely. A lot of people who know the Nurturing Care Framework. Awareness, raising of the importance of nurture, nutrition support, good food, healthy nutrition. Okay, great. Christina's done it. That one I was going to suggest. Supporting parental leave policies, support for working mothers. So I think that's key. Getting different departments to work together. Yes, that would be lovely in government. Yeah. Community resources for parental support. Support to families to provide all aspects of the nurturing care.
Great. Okay, those are brilliant. Let's just come up with a couple of ideas, but these are not set in stone, and open to negotiations. This is a conversation. So the first one I would say would be parental leave. This is my son Noah. My wife always says that if you're going to go around the world speaking about children, you need to make sure that you include our son in the conversation. So this is us during parental leave, and you can see that he's sleeping on my chest, and this is so important to the bond that will be the biggest protective factor and developmental factor in his life. But at the same time, here in the United States, we see so many people suffering because they are not able to have parental leave. And when we had Noah, and we were taken to the room immediately after delivery, behind the curtain, there was a mother by herself with a newborn also, having a conversation where she was saying to somebody, well, I can't come in this week because I've just had a baby. I'll try and come in next week. And this is what you see often in the United States. You get into an Uber and the person driving had a baby 6 weeks ago. There is, well, according to some data, 1 in 4 women return to work within 4 weeks of having a baby. And when you think about cesarean section complications, mental health, this is catastrophic. But United States is one of I think only a couple of countries that don't have a federal parental leave policy all around the world. But there are many more countries that have that policy but don't implement it. In India, I think that it's illegal for a company to force a woman to go back to work within 3 months of having a baby. And I think this is an example of what we need, not just for this to be promoted and set out in policy and law, but also enforced and understood as a violation of child rights and human rights if parental leave is not granted. So at the moment, as a starting point, and it's a very minimum, one of the standards would be, one of the asks could be for parental leave to be in line with WHO standards, which I believe is 6 months for women and 6 months for gestational parents and 4 months for the other parent. And I think that's not enough. I think we all agree that is not enough. But as a starting point to get governments to agree and to move forward, it is a good starting point. So the second one, and so parental leave was one of the ones that you came up with. The second one that I would include is evidence-based parenting programs to be made universally available with a minimum package, perhaps more intensively in early childhood, but continuing as needed at critical milestones through middle childhood and adolescence too. There has been the spectacular piece of work in the systematic review that many of you again were involved with, that looked at with randomized control trials, 435 randomized control trials from 65 countries. What the trial showed was everything you would expect, that parenting programs reduce violence and maltreatment, promote nurturing care, but there's also unintended benefit that became very evident, and that's the improved parental mental health. And I spoke to Bruce Perry, who many of you would know is a well-known developmental psychologist here in the United States. And I asked him what he thought about this. And he said that one part of this is that it just gives parents a routine and a sense that somebody is invested in them and able to support them on some level and to listen to them. And this is so important for parents. But it's also perhaps, and we need to research this more, is that it's a little bit about attachment too, because parents who have been affected by trauma in their own childhood and then are given the skills to form a healthier bond with their own child may be going through a healing process themselves, because we know that love and connection is a thing that primarily heals trauma. And then the third one for me would be universal early learning from 3 to 6, going back again to that early brain development arc and understanding that for all children, learning through play in those crucial early years is essential. But for children that may not be having the stimulation and bond at home, having something, some form of relationship and structured support in preschool while the brain is still developing rapidly could be essential for the child. So that's 3 things that could be considered part of a child development revolution. So that's it from me. I'd like to open up the floor for conversation.
Thanks so much, Ben. That's just absolutely fantastic. And we had a nice number of people online. So yep, over to everyone. If you can just maybe raise your hand and then ask a question, make a comment if it's short, but rather ask a question if you can. Over to, okay, I've got one from Jonathan. And perhaps you could, when you start, just quickly turn on your camera and tell us who you are, where you're from, and ask the question.
Hello, Jonathan.
Over to you, Jonathan.
Hello, Ben. Again, I'm Jonathan Hoffenberg. I'm from a Cape Town-based NGO called the Parent Center, and my question is: so one of the particular issues of South Africa is around unemployment and violence. So in Ben's breakdown of the safe, loved, and nurtured, and the 3 things, was there data between countries where the level of community violence was a lot lower than, let's say, in countries like South Africa? And how does high level of community violence and trauma, in a sense, skew this compared to countries that are safer than ours? Thank you so much.
And you
just want to answer one by one, or wait for a few?
I think maybe just answer each one. Maybe answer each one now.
It's a great question. I hadn't prepared for it in terms of South Africa. I'm not a massive expert on the data. My job mainly is to advocate and to campaign. But one of the things that I do notice is that you have a higher level of ACEs in some countries that have been through some form of violent transition. So I think some of the Latin American countries in Latin America and also Russian Federation, which had an alcohol epidemic in the 90s and kind of a very difficult transition, when they interviewed young people that had grown up in the 90s, I think the level of ACEs was an outlier compared to ACEs in other countries. It was higher. I think the total number of people with one adverse child experience was 80%. So I think you do have a correlation between that, but it's really important to remember also that the parental buffer is really important. It may be that in some countries in the Middle East you have high levels of political violence and conflict, but because of the culture of family and communal care for a child, that may serve as a buffer. So we know that parents being a buffer and community being a buffer and support for parents being a buffer, that may mitigate the risk of ACEs in countries with high levels of violence. But there's much greater experts than me on that.
Thanks, Ben. I've got a question from Dr. Maposa.
All right, thanks, Tom, and thanks, Benjamin, for the quite insightful. I was just wondering, looking at the numbers that you were showing, whether there's some disaggregated kind of data for subgroups, probably within the different populations that are represented in those results, because usually most of these things might not be homogeneous across different subgroups of the population. So I was just wondering if there's any kind of insights around that. Of course, part of what you have responded, talking about Russia and South American countries, I think that also feeds into that. But maybe getting down into within country kind of setups where you've got different subpopulations. How does the numbers, show?
That's a brilliant question. I just want to start off by saying that ACEs research started really in the 80s and early 90s. In the early 90s, and it was done with 17,000 participants, kind of very big study in California, and they were primarily middle-aged and middle class. They were well off. They were private health subscribers, and the adverse childhood experience prevalence was pretty much aligned with what I showed you in the slide. It was relatively high. And what was interesting about that group was it also gave a historical perspective, because many of the respondents had grown up immediately after the Second World War. And so you have we don't know if adversity is getting worse over time or it's improving. There are different factors in that. We also know that that often it's stereotyped as something that affects certain subgroups, but it's very prevalent in across society in the wealthier, more privileged groups too. We do know that in the United States, I believe that Nadine Burke-Harris suggested that we see a higher likelihood of poorer families having 4 or more adverse childhood experiences, but we don't see that higher likelihood with 1 adverse childhood experience. We also know from the data on Native American population here in the United States, the indigenous population, that they have higher levels of ACEs than other parts of the population. And this is often attributed to the fact that there was a concentrated and systematic effort to break up their families and re-educate them through the boarding school system that was built in the United States. So we're at the very beginning of understanding this. Somebody who's looked at ACEs in South Africa will be much better placed to tell you more. But those are just some insights to share.
Thanks, Ben. One of the questions in the chat is, I think, an important one. It's the issue of child development, and I'm not quite sure to who asked it, but is seen as positioned largely in education, Ministry of Education, Department of Education, not health. And the question is, any suggestions for how to advocate for health to take this issue seriously, given an early response is so vital for health?
I think it's a great question. When I think about those things, because I do advocate a lot on universal parenting and universal preschool, and I think that with universal parenting, people ask which ministry should lead on it, and I think it depends on the cultural and the country context and the political context, because in some places it would be the social workers that lead on it, in others it would be health visitors. and in others it would be the education. Surprisingly, education system goes out and works with parents to help get them ready for preschool. In terms of overall coordination, I think it depends again on the country context. It would be great if the Prime Minister's office in many countries would take a coordination approach to ECD, to recognise it not just as an education, health, social policy issue, but to recognise it as a prerequisite for economic, social, and democratic development in the society.
Thanks, Ben. Any other questions? Yes, I've got one from Akansha. Perhaps you can put your camera on quickly, introduce yourself.
Yes, hello. I am from India, and in our country, I have seen that the focus is mainly on child nutrition and infectious disease. Mine is not much of a question, but a discussion point, and I want to raise a point regarding children who are seen like who are marginalized and who are out of the system, who are not being protected by any social protection scheme or government scheme. Uh, right now, we are not even focusing on nutrition or infectious disease or their education. How can we bring the focus of on their development, on early child development when it comes to these children who are seen begging on the road or who are part of any racket? How can we break that particular cycle? Thank you.
I worked recently in a country where we had a program for universal coverage of early childhood development, and we wanted to, the country with our advocacy and support wanted to reach universal coverage, but it made a pledge to reach the bottom quintile, the poorest children first. What we often see with investment in children is that again, it's skewed. The higher investment goes to the children that maybe, I don't want to say need it less, because every child needs to be served, but there is not the front-loaded investment in the poorest children, and we need to do that. And I think there again, I've been talking really about the emotional, social, and cognitive development of the child. I think nutrition is linked to that, but we also have a lot of advocacy on nutrition in our organisation that calls for every pregnant woman to have access to micronutrient supplements to prevent micronutrient deficiencies, to have access to basic nutrition and support and breastfeeding promotion. Again, in terms of parenting support that helps parents and enables them to parent in an optimum way without stress, is much less likely to lead to outcomes such as children being abandoned on the street, but you also need interventions that tackle those kind of problems specifically as well.
Thanks, Ben. Can I just jump in and ask a question? Because I love your framing of the idea of sort of, a revolution. And I mean, I was very struck years ago in reading that book. I think we spoke about it, The Mighty Purpose, and Jim Grant, and this very narrow, and a very specific focus to make the biggest difference. I mean, my worry, I suppose, now is that we've gone the other way. I mean, if you go to WHO, you've got there's an HIV department, WHO, and if you walk out the front door and across the grass, you've got UNAIDS. The very fact that it's disjointed, I think they're problems. And in early child development, one of the issues I often joke about is if you're in a group of early child development people and you're developing an intervention, eventually you'll be doing everything, including carpentry and any number of things. Everything just gets kind of thrown in. I mean, how strategically do we think about perhaps just focusing on the three things you focused on, and how to do that? Because our tendency is to keep adding, because of course it's all important, but actually from a strategic point of view, that may not be the best approach. Thanks.
I think that we live in a culture globally, in kind of policy in general, particularly human rights and development and all of that, where there's been a huge fragmentation trend. If you compare the SDGs to the MDGs that preceded them, they're much more complex and much more masses of indicators and targets. And I think that we've gone along, I think as a world, we've gone along with this without really thinking about it. It's a bit like polarization. Ezra Klein, in Why We Are Polarized, who some of you may have read, said that what happens is the population become a bit polarized, and the institutions, instead of challenging that, themselves become polarized, and the population become more polarized than the institution. It's the same with fragmentation. People began to think more in terms of identity and fragmentation, and to go off in different paths in terms of what are the major priorities for society. The institutions tried to include all of that, and then the population responded. You had a spiral of fragmentation. I'm not commenting about the WHO UNAIDS thing that you're describing, but you do have now, if you go to a global summit or a global forum, people will go and literally say to ministers, you've got a mental health crisis or you've got a crime crisis, you just need to do these 250 different things and you'll settle it, you'll solve it, and it doesn't work. Governments, human rights and development need momentum, and momentum has to come from achieving success together through collaboration that improves the outcomes of the population. So they need to converge around focused things, but the important point is the child survival revolution. They converged around focused things, but those things completely transformed primary healthcare and maternal and child health. They led to vast reforms across the whole system. They did lead to complex change, but the focus for collaboration and moving things forward was around real accelerators. And that's what we need to get comfortable about if we're going to really, live up to our promise for our children.
Thanks. Thank you, Ben. Yeah, absolutely. We've got about 5 minutes left. Any other comments, questions from the audience? Yes, from Rachel.
Thank you very much for a really wonderful presentation. I just wanted to emphasize the point that you raised around the fact that when you look at parenting programs, you're looking at both a combination of a response to trauma and skills in terms of supporting parents to be more nurturing and loving. And I really think that framing parenting programs in that way as not primarily educational but as really support and engaging parents in both the healing process and the engaging process is really critical, because I really want to emphasize that, because it is that combination that achieves the change in relationships. So thank you for raising that. Thank you very much.
Thank you. Thank you.
Thanks, Rachel. So it doesn't look like there's anything else. I mean, if there aren't any more comments or questions, I just wait. We do. Jonathan again. Off you go.
Sorry. I mean, Ben, I guess the question is, given that most parenting programs are often within civil society and the NGO sector, in a sector that globally is facing increasing funding constraints, what do you think is the role of global organizations like UNICEF, World Health Organization, etc., to put pressure on funders to be funding parenting programs more, given that government often isn't able to do these type of broad-based interventions?
That's a great question. I feel we'd have to win the argument, right? Like when I go and speak to colleagues in New York at the UN from member states or whatever, and you speak about vaccines or nutrition, the argument is won, right? The argument is understood. Everybody understands that we need to vaccinate every child. We need to stop malnutrition. The argument is not yet fully understood that we need to ensure that we can ensure that every child grows up safe and loved and nurtured. And that's what we need to, that's where we are. That's why we're at 1980 comparing it to child survival revolution, we're at 1980 if we compare ourselves to that. So we've got a lot of work ahead, I think, to make that a priority in this world where everybody wants to come with the 250 things that you need to do. But we are, I think, beginning to cut through with the argument. The meta-analysis of WHO, led by WHO, all of this is coming to the fore. It's an idea of the moment. It's also in public and entertainment and in regular dialogue in communities. People are much more aware of parenting and metacognitive about childhood. And I think we need to lean into that, deliver a clear argument like the one that I've tried to present today, and get policymakers really excited. Remember, the child survival revolution also happened at a difficult time. It was the Cold War. It was the Thatcherite Reagan era. It was the Soviet invasion of Afghanistan. Apartheid was still, it was a very difficult world then as well. And I think that they built something out of that they improved much beyond the situation of children. And we need to position child development revolution, including parenting programs, in that way today.
Thanks, Ben. Thanks, Jonathan. Yeah, so maybe we should end it there. And I just want to say thank you so much, Ben. That was just absolutely fascinating. And there are kind of lots of lovely comments about what people have learned, how engaging it was. So yeah, thanks again for your time. And we would really love to perhaps have organize a launch of your book next year. That might be a really lovely thing to do. And to everybody, just admin-wise, that you can see in the chat that Chanel has put the link in where if you want the recording, it will be available. And yeah, thanks again for everyone attending. And yeah, and have a good long weekend, all of those that celebrate such things. Thanks, Ben.
Thank you so much. Bye-bye. Thank you.
Bye, everyone.